everybody. Hi, it's Mary Beckman. It's Metaphysical Meltdown, and it's 2 o'clock. We're right on the money today. We are so lucky to have Dr. Cori Bodily-Goodmansen with us. She is a doctor of chiropractic. She's going to be talking about all the miracles that have happened. Well, I'm going to talk about a miracle for sure that's happened in her practice. It's incredible the work that she does, and she does a lot. So if you've been to a chiropractor, just kind of forget everything you know, because there's lots of different styles. I guess she's going to explain that maybe a little bit. And if you have not been for a long time, just understand that there's so many options out there. Happy Mercury retrograde. It happened today. We're welcoming it, honoring you, Mercury. You can't leave fast enough. It's all about relooking, researching, eating chocolate. Well, maybe that's just me, but we'll get through it, everybody. And so if you have a headache right now, drink more water and just be good to yourself right now. I've talked to so many people in the last couple of days that just aren't feeling very good. So make sure that you're honoring your body and resting and having some nice salt and soda baths and eating some good food and going outside and getting into nature. I say that nearly every time because, you know, when I start to feel bad, sometimes I forget the big 3 or 4. And you don't want to, because that's kind of the basis of feeling better. And that's just coming from me. I don't know anything, except I do know how to feel better. And luckily I found Dr. Cori. So she is from North Tacoma, beautiful downtown North Tacoma. And that is where I live. So I recommend her and Dr. Morrow, because they have helped me a ton. So what we're going to talk about today is everything chiropractic, a lot of muscle testing, and some other things that she does, the emotional balancing, etc. I want to remind you that next week is Galactic Week, and we have Kelly, who will be talking about the Akashic Records. We have James from the ECETI Ranch, if you know him, James Gilliland. He's really awesome to listen to. Then we have Todd Rolson and Derek Condit. So Monday is Kelly, Tuesday is James, then we have Derek, and then we have Todd. So please to tune in to Galactic Week. Also, I had someone who said that they are coming in July. So please pray. Not going to tell you who. Boy, will you be excited when you hear that. So pray for that person to have enough time to come and talk to us. So thank you all so very much. And without further messing around by me, I'm going to introduce Dr. Cori Bodily-Goodmansen, chiropractic extraordinary doctor person from Tacoma. Here she is. There you are.
Well, hi, Mary. It's very nice. Hi, everyone. I'm Cori. Like she said, I'm a chiropractor out here in North Tacoma, Pearl Chiropractic. I also am a clinical nutritionist as well. I found out rather quickly, starting a chiropractic business, that if everyone had their nutritional status on board, chiropractically, their health would improve much quicker, much easier if everything was on board. So I went back, got my graduate, my master's in nutrition, and started that. And I, through that, I started realizing that there was much to know about nutrition, many supplements, many supports that you could take. And sometimes you walk in and to a health food store and feel like you need to take 100 supplements. So I found a technique that is referred to as blanket muscle testing, but there's a lot of different methods out there that I'll kind of go into. But I found that so I could actually narrow things down and treat people uniquely. And of course, like with all my practices that I do, I found it because of my own experience. I was told rather early on in life, someone like yourself, Mary, that I would experience a lot of physical issues, a lot of emotional issues early on in life, so I could figure things out and help people in, as I go along. So during that time that I got my nutrition degree and was learning muscle testing, I actually had my low back just completely go out. And being a chiropractor, I have a lot of access to therapies, massage, chiropractic. I even did some emotional release, trying to get everything on board. And it was still quite painful, So I'm thinking, okay, I've got something to learn here. I was at the muscle testing seminar training, and somebody tested me and said, your kidneys are weak. Here's some support. Start this right away. And I took it that night. In fact, I even doubled the dosage, but I took it that night. The next day, I would probably say I was 95% better. And so this little light bulb went on in my head. I said, okay, this is something I need to pursue and look into, because, I've gone through those experiences where, there's always a question mark. Well, I can't figure out what's going on with you. And so I have to dive deeper and figure it out. So that's that was my beginning of my journey with the muscle testing technique, which I'll talk about in a little further. And then along with chiropractic, you also mentioned the energy best technique, which is bioenergetic synchronization technique, which is what it stands for. And that energy work is actually what got me into chiropractic. So, many years ago, before I decided to become a chiropractor, I was quite ill to the point where I couldn't get out of bed, and somebody introduced me to a chiropractor that solely did mostly just energy work on me, the best energy. And within, I would say, a month period of time, I was back to feeling normal. And it was then that I decided I wanted to be a chiropractor, not actually because of the chiropractic, but because of the energy work. And so that is actually what spurred me on into my profession. So I learned very early on that you have to have everything on board: mind, body, soul, nutrition, structurally chiropractic, or, the soft tissues, and mind. Everything has to be in order to achieve that health status.
Absolutely. And I recall how many years you have to go to school to just be one of what you are, which is a chiropractor, because I have interviewed chiropractors before for my books, and I listen to all that they have to know. I mean, how long does it take to become a chiropractor?
I would say total with all the schooling, about 8 years.
Mm-hmm.
Yeah. And I was able to do about 2 more years to get my master's.
Okay.
Yeah.
Wow. That is amazing. And I just want to say really quickly why I came to see you, because I was writing notes, as I do always before I talk to anybody, and I was counting up the chiropractors I went to over the last probably more than maybe 40 years, probably. And
You started when you were 1.
What's that?
So you started when you were very young?
Oh, I was like maybe 15, 16, maybe. Yeah. Good. And everybody helped me in all the different ways. They all helped me. And I added up in my mind thinking, how many sports cars from the 50s could I buy for all the money I spent on chiropractic care? But, I spend it once a week because it is so important to me, because I can actually say it helped. So with all the different weird things that have happened to me throughout my life, all the massive crap that was stuck in my body for different reasons, and just because I got in a lot of car accidents, I really needed that. And it really has been the thing I can count on every week to feel a little bit better, And so when I met you, I said, my stomach hurts so bad, it's hurt for 10 years. Why does it hurt? I don't know. I've asked everybody I ever met, why does my stomach hurt? And so Dr. Cori figured it out, everybody. I had parasites, and I was massively allergic to a bunch of stuff. And I had bacteria in my stomach. And I took to calling my parasite situation my emotional support worm, because I'd had it for so long. It was probably there for a reason. And she was able to, through a bunch of things, she was able to get that out of there, man. And I can't tell you how relieved and thankful that I am, because it's extremely painful. And it was probably 10 years. So
yeah, and
bless you.
Well, it's all on your part. It's kudos to you for pursuing it and pursuing that journey of health. A lot of times I would say the biggest message that I want people to always know is that there's about 90% of your symptoms and your elements and what happens to you that can be resolved naturally without throwing medications or surgery. That is usually the first line. There is that 10% obviously that that needs to be referred to a doctor, but there's so many things out there that can support you. And it's for some people, you do have to do the work, right? You do have to make some lifestyle changes. It's not easy, right, Mary? There's some things that you have to be ready for. Mm-hmm. So you do have to be in that point in your journey, but once you get there, things are resolved and things let go, and you can move on with health, instead of having something that's just managing your symptoms and creating more symptoms. So the biggest message is for people, it's just, if you have something going on, don't give up. There's people out there that have the tools, that know how to help you, that can support you. If I have someone coming to me chiropractically, energetically, nutritionally, and for whatever reason, I can't get to them. I have a lot of practitioners in the office or people that I refer out to that I know can get in a different angle. We have excellent massage therapists here. Myself and Dr. Kina, the other chiropractor, and the other nutritionist, Maria, if we think we need to refer something to we have an acupuncturist here. And actually I haven't told you this, Mary, but we have starting next week, we have a gal coming in that does lymphatic drainage and detoxing, which is going to be very exciting because that's quite needed. And she does thermography scans, which are a great alternative if you're can't get the mammograms. So she does that. So that's pretty exciting. But just knowing that there's so many tools and resources that can help you if you don't give up and just seek the care.
Exactly. And what I love about nutritional care is that when the problem is resolved, then you don't take the little pill, or not a pill, but the little supplement again. I mean, have you guys ever heard of that? Could you imagine going to your doctor and having your doctor say, "You're done, you don't need that pill anymore"? It doesn't happen, and I'm not negative on the Western medicine. I'm not. If I broke my leg, I would probably go, maybe. But what happened to me was I had a lot of medicine, and then I had the medicine to help allow me to take the medicine, and then I had it for the side effects for the medicine, and it was messy for people who are very sensitive. So if you are a sensitive person and you have an issue that you have had for very long, please check out nutritional support, check out energy work, check out chiropractic, because now chiropractic, that's just a thing. I remember a long time ago when I was younger, it was considered something a little out there, but now it's every day because people know it works, just like acupuncture, isn't it?
Yeah, most of the times covered by insurance or programs that are affordable to help you. But yeah, if you can keep yourself from, especially right now, our current time, right, we have a lot of energy and anxiety and things that are going on. If you can keep off, because the antidepressants and the painkillers are just skyrocketing. If you can keep yourself off those by getting some treatments done, by getting some natural support, that's huge. I mean, the opioid crisis right now it's insane. It's almost becoming, I think, 2017, the third cause of death. I mean, doctors between the year of 1997, between 2002, I think the prescriptions of opioids went from 670,000 to something like 6.2 million. I mean, just outrageous. And then it just kept going forward from that. So, my goal, and along with other practitioners in the office, is to help, keep, so you don't have to get to that point. Right. I don't have any other option. This is what they're telling me to do. Western medicine is great. Like you said, you have a broken, you have a fracture, you have some huge infection that's just ramping rages. Mm-hmm. They are great for that. And thank you for them for being there. But something that's chronic illness, autoimmune, parasites, Lyme disease, a lot of that, they just don't have the handle on a lot of the therapies. And so they're thrown antidepressants or painkillers because they don't really have a certain protocol for them. There are a million protocols, naturopaths and nutritionists and so forth, that have to help this, keep you off those medications. And sometimes people don't realize that there's that option out there. So if you can get anything from today, know that I can give you resources to look up in your area and what to look for with people that have the support for you. But that's the biggest thing is let's, and I think, and I really wish, my biggest wish is that there would be more focus right now in our current state on strengthening your immune system, getting your anxiety down, staying in a place of love and gratitude, and not letting all of that energy that's surrounding us creep in, because that's going to affect you physically. So just really amping up huge with the immune system. And if you do meditation, great. Going for walks, keeping the news down low, because I've been able to stay open during this time, and I've seen so many people come in just worried about the finances, worried about their safety, worried about getting sick, that brings your energetic level down and opens you up for receiving more negative and illnesses. So if we can just, I've actually had to do more work to keep my vibration level up these days, because I'm feeling the the energy coming. So doing a lot of that work to keep your vibration high right now is crucial.
Yes, absolutely. You gave me garlic and vitamin C. And I'm taking them. Yes, I am. So Marty is reminding me, which is just what's coming up next, is that we are going to ask Dr. Cori to describe what type of chiropractic she does, because it is a lot different. I'm sure everybody's been to all kinds of different sorts of chiropractic doctors, and they're all a little different. So can you tell me, when it's ABC chiropractic, what does that mean exactly?
Well, ABC just, it stands for Advanced Biostructural Correction Technique. That is one technique I use. I have a couple of different techniques that I use. Activator, which is the low force technique, that is it with an instrument, very specific. So we're not, a lot of people come to us directly for that because they're scared of the whip and the snap, you know. Right. So it's a very gentle form of chiropractic and very specific. So we're only moving the actual joint that needs to be moved, and we can do a lot of extremity work, because we can get into those small joints with the device. And we adjust newborns all the way up to, you know, our oldest patient 99. I mean, it's very gentle, that can be used with everyone. So, and people come in that have been scared to go to chiropractor for years, and after their first treatment, they say, "That's it?
Yeah.
What was I so scared about? I know, I feel great." So that allows us to, you know, treat people that don't really want to go down a huge, you know, a different path. But, and you're right, every chiropractor treats differently. They have different tools. It's all this, we all end up at the same place. We're trying to align the spine so the nervous system can work correctly, get out that interference. Everyone does it differently. So the ABC, I started about 7 years ago. And that really focuses on, you have this meningeal covering around your spine, and it's kind of a connective tissue that covers the spine. And that can actually get knots all the way up the spine. And sometimes with massaging and adjusting specific joints, you know, you can get in there and adjust, and then it comes right back. And people will sometimes say, "Oh, I feel a cord and it's just pulling, and it feels like my adjustment's not holding." And oftentimes these people have been in several accident injuries, and that's kind of gives me my first clue. And so if it's a little bit more hands-on and a little bit more movement than the activator, but if people are open to it, and I can get some releases going from that meningeal soft tissue covering, we can really get the spine to start holding. And that is just a method that no other chiropractic method addresses. And then it also makes you look at posture. How are you sitting? How are you standing? How are you laying? How is your pillow? Checking in on those two to make sure that those are structurally holding you as well. So I don't ever do the same thing to one person. So it depends on what you have going on, and, you know, where you want to go, what your comfort level is. Every adjustment is different, really.
And the difference, I think, between you and other folks that I've been to for 40 years, is that you made me realize, what are you doing with your posture during the day? What's your pillow like? What's your chair like? I had to replace the chair that I sit in, mostly, not this one, but the one, you know, that I hang out in. I replaced that. And I got this big pillow to hug at night so my rib cage doesn't roll. And so Marty wants to know, and a couple of people are saying afraid of the, so that is just the gas coming out of the vertebra, right? When you do the manipulation. When she does the little activator, it feels like click, clink, click, clink, click, clink, click, clink, and snap, snap, snap. And you don't think you're going to feel better, but you do. And somebody that we care about a lot, I might live with him, didn't think he could turn his neck. He went one appointment with Dr. Cori, he could turn his neck. I mean, he hadn't turned his neck his whole life. So I just think it's pretty remarkable. And some of the other stuff that you do, though, that head manipulation for me is just beautiful. Is that the thing you were talking about there? Okay, because that's really great if you've had a head injury like I have.
Yeah, that would be they call it the meningeal releases in the ABC. So that's actually releasing the tissue. But yeah, if you're doing, sometimes you'll hear some popping the gas cavitation from the joints with that, but with the activator you don't get any of that. You don't hear any of that. So it's just, I mean, it feels like someone's just poking you just a little bit, but what it does is it goes, I should have brought it in with me. it's a tool that goes into the joint and it actually moves it fast enough that your muscles don't even have time to guard against you. So it really works well for those people that, I'm not going to move my neck, and you can't even, you know, put your hands on it. I just gently go with the activator, click. They don't even have to move because the activator does all the movement for them, and their muscles, it gets in there before their muscles can fire. So it's able to be used on most everyone. I even use it on dogs when we need to, little puppy heads when they have a crash or two. So it's pretty gentle.
And you do work on pets, don't you?
Yeah. Most, I would say 90% dogs, but I've had a few other here and there along my career. Some cats and a rabbit, guinea pig, but mostly dogs. Yeah, mostly dogs.
I noticed that when we took our pug to my chiropractor that was in West Seattle that actually moved, that dog got a cheese. For 20 years, I went to those people. I never got a cheese. What's the deal? But seriously, Marty, the little thing does not hurt, and it can make a really big difference. So can you explain the kind of muscle testing that you do? I find it really fascinating.
Yeah, so there's different types of muscle testing. So if you're looking for a practitioner that does it, you want to look for people that do NRT, which is nutritional response testing, which is part of what I do. You want to look for ART, autonomic response testing, which is I do a little bit of part of that. And that was, interestingly, that was an MD that created the ART muscle testing technique from the original muscle testing AK and a little bit of German, because he's from, I think, from Germany, German muscle testing technique. He's actually up in Kirkland, our home, you know, close by. He teaches all over the world though, this technique, and he has a huge clinic. So that's a really goes deeper down in those levels to test people. So you want to look for NRT, ART, AK, applied kinesiology. That was the original Dr. George Goodhart, the chiropractor, I believe back in 1964. He created the kind of the original form of muscle testing technique, and then it took off from there. So in my practice, I do a combination of the NRT and the ART testing. And basically it's just going through your body, testing your neurological reflexes by using a strong muscle, you know, wherever that is. And how I explain it to people, how it works, is that your body has a natural neurological reflex where it wants to protect your core and your brain just automatically. Mm-hmm. If you, for example, if you jump into a freezing cold lake, all of your blood and your energy from your extremities are pulled in to save your core and your brain. So because it knows that that's what you need to live. So we use that reflex as we're going along. We're testing different reflexes. You know, you've got your thyroid and different things. As we're putting a little bit of pressure on that, if something is inflamed or it's not working properly, it's dysfunctional, the core is going to perceive it as a little bit of stress, draw energy out from your extremities, so your arm will go weak. So that's originally how I explained how it works. And then we get down to what is the major problem that your body really wants to focus on. Is it your stomach issue? Is it your depression that's going on? What does it really want to focus on? Then we start there and we just work through the layers. And like you said, I call them two different supports. There's your maintenance support, like your vitamin D and your minerals and your vitamins that you take every day. And there's your restorative support. So that's herbs and homeopathic and supplements that that you take for a reason, to restore thyroid function, to restore brain function, to restore pancreas, to help support the liver function. And as soon as you take that for a period of time, sometimes it could be 3 months, because that's 90 days is a good frame reference to restore or make permanent changes in your cells. So we get that on for a period of time, and I follow you. And as I'm testing, if things are stronger, symptoms have gone down, then you gradually come off that, so we can get that gland or tissue working on its own. So it's not something that you have to take for the rest of your life. So I've seen people come in here that have gone, they've gone the medical route, and they've said, I've done this test, I've done this exam, I've been probed, I've been prodded, I've been x-rayed, I've been MRI'd, and no one can figure out what's going on. And so as we get down, okay, well, I have some what I call stressors that I test. You know, let's see what's okay. It's your thyroid that's coming up, or it's your small intestine that's coming up, and it looks like that it's resonating that there's certain foods that are aggravating it, or it looks like there's certain, you know, bacteria that it's responding to, and let's get you on a program that is designed for you to resolve that and restore that, and then we just go from there. So I've been able to. It's a very rewarding, because I get to be that vehicle that helps people that are sometimes hopeless, without hope, that come into me, and the first words out of their mouth are tears, because they can't manage that, they can't think that there's anything that can help them. So it's great to be able to be that vehicle to say, okay, let's get started.
And the thing I love about you is you are one of the most thorough practitioners I've ever met. So if she needs to send something out, or you need to go get blood work or whatever, she's going to do that. I love that. So when I met you, I said, I've been on something for Hashimoto's thyroiditis, which is autoimmune, for 20 years. And I said, I don't want to take it anymore. And you said, we're going to go slow. And sure enough, I don't take it anymore. I take a supplement. So yes.
You were very tenacious. I said, Mary, like 20 years is it's cutting it close. I don't know if we can get that thyroid going. That's very close. I said, you're gonna have to do a lot of work. And she's like, where do I begin? And she did the work. She did the work.
I discovered a long time ago that you can actually talk to your body parts. So I just said, come on now, thyroid, just like pulling the string for the lawnmower. Yeah, come on now. and you can, you know. And one day I talked to my stomach. I said, what is going on? You're not paying attention. But if you guys don't know, if you're allergic to something that you're putting in your body every day, when you find it out and you quit eating that, life is different, man. Because what I figured out from gluten, which I'm massively allergic to, I can just look at the cake and down the hall to the bathroom. So once you quit eating wheat, your brain fog clears up. It's a miracle. And I've heard that word, it's a miracle, about Dr. Cori a few times. Wish I could tell some of those stories, but I can't. But what sorts of cool things have you done? Can you just, without people, of course, could you say, what cool things have you seen happen?
I've had people come in here that with chronic digestive issues, small intestinal bacterial overgrowth, parasites that have come up that no one, you know, could figure out, autoimmune diseases that have been able to get better. I've had people come in here that were severely depressed and anxious and saying, I don't want to get on the antidepressant drug. Can you help me? Mm-hmm. And, you know, along with some other treatments, maybe acupuncture and so forth, we were able to, and still have been able to keep him off the antidepressants. I've done that with a couple of them. One was a war veteran. So I did a combination of energy work and nutrition, you know, with him, just to be able to keep him off the anti-anxiety meds. So, and I've seen a lot of people come in here with this chronic pain, that if they're willing and they're open and they're ready to do the work, that I slowly see their attitudes improve and joy come back to their life. People that have come in here with infertility and been trying to have a baby. And I just recently, it seems like this last 3 months, we've had some good news with people getting pregnant. So that's always a joy to hear. I've got 2 little rugrats of my own, and they're quite a joy to have. So yeah, just a lot of great stuff. In fact, I mean, especially chiropractically, I'll have people come in and you just think, oh, dude, they're ornery, and you know, there's no smiles coming in, and people with chronic pain, you get that way. You don't want to smile. You don't want to be joyous. But there's oftentimes they will leave and they're smiling at the front desk. Thank you. We'll see you later. And my front desk looks at me just, what just happened to them? But you see this transformation. And sometimes, especially chiropractically, you see it very quickly. So it always makes our job really fun, for sure.
That is wonderful. And everybody, if you did not watch that video that I shared today, it's the only one I shared today, Jason Estes, he's talking about that level of joy that you just step into. And happiness comes out of that. It's a very interesting way he puts it. So he says more in 5 minutes than anybody else in the whole world. And I love him. And so I have had chronic pain for, I don't know, since my first car accident at age 16. And yes, you don't want to get out of bed. And yes, you're depressed and you want to get better. And I can tell you that any kind of drugs certainly did not work for me. I tried them for years until one day I said, no, I'm done. All kinds of different things, you know, things that, God, there's so many things they give you if you go through the traditional route to try to feel better. And nobody starts out saying that they'd like to take 5 things or whatever, you know. They start out by saying, I want to feel better. Can you help me? And so I noticed that I know some people like this, and I know it's true for myself. We actually have a big fear of doctors. And it happened to me the other day. I went into my brand new doctor who turned out to be really great. I thought if I ever break my leg, I got to have somebody in Tacoma. I went in there and my blood pressure just skyrocketed. And I realized that I'm so afraid that they're going to push something at me, that I had the white coat syndrome. So if anybody's out there like that, Dr. Cori is nothing but kind. And she actually has some ways that can really, really, really help you. So can I please ask you about cold laser? I think that's fascinating.
Oh yes, we have our Kodiak cold laser in our clinic. I love it too. It's a red light frequency. Everyone's heard of laser frequencies. There's, you know, you get the laser eye surgery. They're doing lasers with surgery. So there's all different types of frequencies. This laser in particular is called cold laser because it doesn't create heat. In fact, when you put it on, you don't actually feel it unless you're very, very sensitive. I've had people actually feel the frequency,
Mm-hmm.
but you can, there's 4 different frequencies that come out of the laser, and you can enter the frequency code so it can directly help with inflammation or help with scar tissue. Do it a lot with brain for concussions.
Mm-hmm.
It works great. So for brain tissue, for organ tissue, inflammation in the gut. So there's a lot of ways we can utilize it, and it's super simple. You just put the laser on, let it stay, and people sit there and you don't feel anything. I mean, it's the easiest therapy we have. But that light frequency can make a huge difference, especially if you have a lot of scar tissue, especially surgical scar tissue, that can sometimes cause some interference with nerve signaling. And sometimes just getting that scar tissue to resolve makes a huge difference with how your body operates. Again, removing the interference. And the light frequency, just if anyone wants to know the science behind it, it goes into the cell, right in the center of the cell, and it creates ATP power. So ATP is the energy of the cell, what generates it. So it just gets that ATP and says, okay, get moving, get healing, get moving. Mm-hmm. And it just drives in there at a certain frequency and just starts the healing process. So it's especially people that have had surgery, you know, that the knee surgery, let's say, and they're like, oh, I just got a knee surgery and my PT's having a hard time doing this range of motion and I can't get it to go past a certain point. We do a few sessions of scar tissue laser and they're able to do the full range of motion, you know, to get that scar tissue healing and moving. So, and I can tell you from personal experience, it works great with concussions because I've given myself several concussions over the years and just use it on myself. I use it on my kiddos. So my 2 toddlers that literally probably bang their head every day. And sometimes if it's a whopper, I'll bring the laser home and just laser them. In fact, there's a great story about in fact, Mary knows most about this because I had to tell her about it, but my youngest 1.5-year-old got his finger slammed in a door frame and the tip of it came off, sorry to be graphic, but was able to be sewn back on the whole bit. And I had to do weekly follow-ups with the doctor. And in between that time, I was doing a lot of laser, right? Scar tissue laser on his finger. And the doctor said, I've never seen a finger heal up so quickly or so fast. She's like, hey, look, this looks amazing. What have you been doing? And I told her, and, you know, she's like, let me write your number down so I can refer some of her, you know, her orthopedic patients for the laser. So that was a good testimony on.
That's great. That's
yeah.
great. Well, I remember when my hair fell out, I got the Holy Mother tattoo, and Holy Mother, she didn't mean to make me sick, but she did. And so remember all the times that you put the laser on, and my hair grew back and everything's fine. So sometimes body doesn't like the ink. And let's see what else I want to ask you about. And I know that you do seminars sometimes at your place. Can you talk about that?
Yes, we love seminars. Well, they're on hold, obviously, right now for a little bit, but we love to do seminars. We do, gosh, I've done seminars on so many different topics. We do a lot of detoxing seminars. Mm-hmm. We've done heart health seminars, mental health seminars. We did 5G, so the 5G rolling out the radiation. We did that last fall, November, and how that affects you and how you can protect yourself. So, and then sometimes I'll do it. I'll have a practitioner in my office do it, or sometimes I get guest speakers to come in. They're usually free for patients, and patients want to bring their friends. Typically, they're typically 6 o'clock at night. Mm-hmm. We usually have one once a month, but obviously they're on hold. But my favorite thing is talking about health, right? So for me, I love giving seminars. I honestly, truly believe that health should be your number one priority. If you don't have your health, you can't take care of yourself. You can't enjoy life. You can't take care of your loved ones. You don't even, at some point, you don't even enjoy the relationships that you have around you because of your health. So your health should be your number one priority in order to be able to help other people and enjoy life. So, you know, if I can instill that in people and tools, you know, my job has been done.
Yes. Well, if we didn't learn that in 2019, everybody, we've got to learn it in 2020, that we are our first priority, just us. Nutrition is the beginning. Also, I have a name for a new seminar for you. You've got to call it 50 Ways to Love Your Liver.
I like it.
You do. So tell us about what we can do for our liver, because for me, taking all of those, you know, injection, or what do you call them, vaccines a couple times in my life, taking meds throughout my life, all those times of, oh, why don't you take an antibiotic, really caught up to me, and my liver was not having any fun whatsoever. So can you talk about clearing it out?
Yes, livers are huge because they have so many functions in your body, and they clear out all the junk, right, that we ingest and medications and all that. And they do get worn out and sluggish, right, and backed up. But the good thing is they're very regenerative. So I mean, you clean the liver out, and it's very regenerative, and your whole body can feel it. A couple of clues, if your liver's not up to snuff or up to par, you'll start getting some edema, some swelling around the abdomen. So sometimes with men, you can notice they'll have the round belly, right? That could be a clue that the liver's backing up. Sometimes if sinuses and lungs get full, mm-hmm. right, that can back up. So, which is a big thing right now to, you know, make sure we're staying away from viruses, get your liver checked. A lot of times people will really crave fried food. That's an indicator too. If your liver's out of balance, the fried food craving goes up.
Interesting.
Yeah, there's a lot of little different things. Like your cravings and different things that you can notice that you can tell what's going on in your system by not even doing checks, but your body's trying to give you little clues. But there's a million different supplements and detox protocols that can clean out your liver. But milk, you know, obviously milk thistle is a great one. You know, getting some garlic on board, beets. Eating beets is a really good one. Cilantro is great at cleaning that out. Sometimes people will do you heard of castor oil packs? Mm-hmm. So getting castor oil in a hot pack and actually putting it over your liver can do a good start of a liver detox. But there are several detox programs that we have available that really will clean up the liver. And it takes, I mean, you can do a big chunk of it about 7 days, but 21 days is what you want to plan for to really get everything regenerated and going. And a lot of times, I mean, we even have a shake that people can start on, right? Just a shake that you mix water with, and it starts clearing out your liver. But, you know, a couple other things you can do when you wake up in the morning. So your liver starts to do its job around 3, 4 o'clock in the morning. Mm-hmm. It starts to clean and detoxify and do all it's supposed to do. So when you wake up in the morning, it's still working, right? It's still trying to do it. It's clearing detox. So if you get some water with lemon in there, or some celery juice, or some juice, just to help facilitate, you know, get the cleaning, toxification still going, right thing, you know, right in the morning, and eat some fruit. So the fruit actually will also be cleansing, and the liver will absorb that glucose for storage later on from the fruit. So that's really good things to eat in the morning time. Because once you start putting in right away anything that has fat, protein, alcohol, caffeine, those are the stuff that will say, oh, liver's going to stop working and say, oh, I got to get to processing. So I got to, you know, process this protein, and I got to work on breaking it down, and I've got to work on the fats, and I've got to work at processing this caffeine out. You know, it stops doing its detox work, and it starts doing all the processing. So if you can just wait, even if it's a half an hour or an hour in the morning, and you do some water with lemon, do some juice, get a little bit of fruit, and just let your liver kind of, okay, let's just clean everything out. Just doing that step will help you.
Okay.
Yeah.
All right. Well, I seem to remember eating a whole bag of chlorella for like a year. I didn't get a shake. I just want to say I'm protesting. I ate the chlorella. Well, so kids, if you guys have a question for Dr. Cori, oh wait, somebody just did. So what type of information do you have for Barbara, type 2 diabetes? What can she do?
Yes, type 2 diabetes is not the easiest, but one of the things that you can actually reverse by doing lifestyle changes and support changes. So obviously one thing is starting to get the pancreas and the liver working. And she probably already knows all this, you know, watching your sugars, watching your carbohydrates, bringing that down low. Walking is a big thing, because that starts lower, you know, 40 minutes of walking will lower your blood sugar, you know, leveled out. So doing a lot of walking, at least for 40 minutes, you know, at least 5 times a week, that's big. Watching your sugars. So if you can keep your sugars below 35 grams a day, try to keep your carbohydrates, you know, lower than 100 grams, get those carbohydrates down quite low. And then there's a lot of Gymnema. So Gymnema herb is a good one to help maintain that sugar balance. If she is interested in slowly, you know, weaning off, if you know, metformin or insulin or so forth, but having somebody practitioner help manage that. There's a lot of different combinations of supplements that can help with that we have here, or you can get from other practitioners. But just making those few changes without even seeing a chiropractor, with, you know, increasing the walking and watching the sugars and the carbohydrates is huge. And then also bringing on that emotional state, right? Okay, how did I get here energetically, and dealing with that. Anything that that you really want to heal, you've got to say, okay, is there any emotions or anything that's attached to this that I need to let go? They've shown in several times when people go into surgeries or, you know, big things, that if they really dig deep and say, okay, I've got to let go of whatever it is in this area that, you know, keeps regenerating, that the surgery will go much quicker. They won't have to do it again, and it's successful. So getting all of those on board.
Absolutely. I definitely always work with the emotions of a person when working with chronic pain or anything, actually anything. So I remember, I think it might, I can't remember, it might be in the Emotion Code book, that the author was putting forth that he wondered, maybe he's answered this question, 2 more books have come out since the first one, but he was wondering at the time in that book, were emotions actually made in each organ? Have you ever thought of that?
Oh, yes. Every organ has an emotion that resonates there. You know, the liver's a lot of anger, frustration, right? Mm-hmm. So the gallbladder, a lot of resentment can can be held there.
Mhm.
You know, kidneys can be a lot of holding on to fear, you know, different things like that. And, you know, that lower back is a lot, you know, down through the sacrum is your security zone. So a lot of times when your security, you lose a job or something goes out, then that, you know, your lower back will go out. Ribs have to do a lot with grief, especially with people, and you know, grieving and letting go of people. Pancreas, I can't think of the top of my head what the pancreas is. Just lost that, but there's a lot of books like Louise Hay, you know, you can look up pancreas and it'll tell you what the emotion is that is connected to that. So there's a lot of other different EFT, there's a lot of other different books that where you can find, there's actually some things that you can say without even getting an energy work done, to things that you can say in the morning, you know, I let go of anger, frustration, and replace it with love and gratitude, that type of thing.
Yes, there's so much you can do with just the word, just to get in your subconscious. And then also the emotion and body code, where you actually assist the body in removing those trapped emotions, like in the pancreas or the liver or the brain or the heart, whatever it is. So we have another question. Angel asks, what information do you have for complicated migraines? Oh, I'm so glad somebody asked that. Thank you, Angel. And if anybody else has a question, please to ask. Go ahead.
Yes, migraines can be complicated. I agree. So the number one thing I check out, is it something structural that sometimes, especially up in the upper neck, the upper cervicals can get twisted and torqued depending on how you're sitting, or if it's from an old injury, or, you know, what have you. So checking that structurally, whether we need to get, you know, massage therapy on board to release the soft tissues and get things stabilized. If it's not coming from something structural, okay, obviously we want to rule out anything pathological, neurological. But beyond that, is it something that she or he is eating, whether it's a food or a drink, like perhaps sometimes I've found Diet Coke can, you know, cause migraines. Or is it something environmental, something she's breathing in, something she's around? I've had one lady that had complicated migraines and kind of went through a list of questions and found out that she had her cell phone turned on right by her nightstand on her bed. And she slept all night with her phone on. And if you do that, that's sending a lot of radiation directly to your head, and thyroid are the biggest ones. I said, turn your phone onto airplane mode. You can still use your alarm clock. Get it away from your bed. Take it away from your head, and migraines quit. So it can be something, you know, environmental. It could be mold in the house. It can, you know, there's several things that the list that you want to go down. But I tend to start obviously with something structural that usually is typically the case, but it's also some external things as well.
I had migraines for years, and I had the top bone, is it the atlas is your top bone? I had that put in place by this particular practitioner. And when he got done with me, it's a process. When he got done with me and I stood up, it was like my entire consciousness came in for the first time. Very odd. So Angel, do you have a migraine right now? If it's yes, I want to tell you something. Okay, so Marty says the lack of sweetness of life, which is diabetes. Louise Hay said that. She's somebody I'm going to find when I pass away over there on the other side. She's a wonderful person. Of course, we could probably ask Auntie Louise to come in now if we wanted to. So let's see. Barbara Hall, I think, is using prednisone for her lungs. Is there something else Barbara can be doing? Maybe that's where she's going with that.
Well, it depends on is it for asthma?
No, let's see. She's the person who asked about type 2 diabetes. She said it was drug induced by, I understand what you're saying, by prednisone for her lungs. I understand that threw her into diabetes.
Oh, that's how she developed the diabetes?
That's what she's saying, I believe. I think that's right. I hope that's right, Barbara.
So you'd probably want to get a lot of pancreas tissue strengthener and a lung tissue strengthener on board in her protocol, just to help to regenerate what damage was done.
Okay. Yeah, she said she had restricted airway disease, possibly asbestosis. Okay.
Oh,
I'm sorry
yeah.
you're dealing with all of that. My gosh. So Vicky says, I struggle with acne. It's related to stress. I'm also guilty of not so good face washing routines. Any advice for me on that? That's Vicky.
So acne can be stress, yes. It typically will stem from hormones. So if we can balance out the hormonal situation going on, get a few of the maybe the irritation foods out of the diet, that can help tremendously. And anything else that pops up, ways to handle stress. I know a lot of people have done a little icing on their face just to get the inflammation down with that. And the gal that's coming in next week that's doing the lymph drainage also does facials for that too. So there's certain things that treatments just to get things started and out, but really balancing the hormones internally going forward is what's going to keep it at bay. Okay. And that's, not to say that you have to take hormones. There's a lot of natural stuff for that, but knowing where the hormones are at, either through muscle testing or blood work, can help balance it out. Yeah.
And I just wonder too, Vicky, have you noticed your acne has been worse lately? So I noticed that as I clear and as this energy passes through, my face will break out. So you know what I use? It's organic carrot oil. It's kind of an odd thing. That's what I clean my face with.
Mm-hmm. Yeah, that's a good one.
It works great. You can drink it. It's really good. You could if you wanted to. You can put it on your skin for nice soft skin. Put it on your tattoos. And then of course I switched over to coconut oil. I don't know if that'd help, but a spoon to eat, a little bit to cook with. It's just awesome.
That's exactly what I do.
It's the good stuff. Okay, so Sandy wants to know about Hashimoto. So you must have missed the part about what I was talking about. So she's great on Hashimoto's.
Yes, we support a lot of that.
Yeah. So why do you suppose people get that in the first place?
Whether it's genetic or the way that your thyroid starts to break down, their thyroid starts to have a dysfunction, and then an autoimmune reaction starts happening. So the thyroid gets all jazzed up, and then it jazzes up the immune system, and then it makes the thyroid worse. And the sad thing is that unless you push your doctor, really the main things they test for is the TSH, sometimes T3, sometimes T4, but really they usually don't go beyond the TSH, because no matter what it says in any other category, it's the same medication. So they view it as a waste of money. But if you get the TPO, the autoimmune thyroid on board, then nutritionally, naturally, you can actually start to support that and reduce that reaction. But unfortunately, they don't really view it as anything that they see invalid, because they have the same medication, whether you have it or not. They really base it off of what your TSH, your main thyroid stimulating hormone, is, whether it's high or low. So sometimes I have to, I'll either write the blood work myself, or really say, you got to press your doctor to do this, so we know exactly what your thyroid's doing, because functionally it makes a difference. With Western medicine, it really doesn't make a difference. So
okay. And so you can support all kinds of autoimmune stuff, can't you?
Yeah. I use the word support, not treat, because we don't treat, we just support the body.
Mm-hmm. For it to heal, for it to begin to heal.
Yeah, exactly.
So if somebody has, say, lupus or, gosh, it's right out of my head, another type of autoimmune option, they can come to you. You'll test them out with and it's interesting how she does that muscle testing though, because she goes quickly, but you challenge it with the supplement, don't you?
Yeah, or the stress files that I have. Mm-hmm. Yeah, they're in fact, I'm in my nutrition room right now, so I'll tell you. So they look just a little bit like this. There are chemical structures of different types of particles in there. So they've broken down certain foods, certain bacteria, certain viruses, parasites, that type of thing. And if your body has a reaction to it, then we know we've got to dig deeper on that subject. So I've had several things that I've had to deal with myself. So maybe people can relate to this. So which it helps me because it helps me keep my compassion and know where people are coming from. You know, I grew up in a very Western medicine family. So I had a lot of antibiotics on board, you know, by the time I was 15. And by the time I was 16, I had huge gut problems, 16 on up. And, you know, was very involved in that will of, let's put you on Pepsid AC, let's put you on this, oh, maybe we'll have to do a surgery and close off your esophagus. And I was 20. Who wants to have that done when they're 20? I mean, so early on, I started having these issues. And so I started doing a lot of my own research, you know, getting frustrated that people weren't really diving down to the problem. Okay, I'm going to do it myself. So learn a lot that way about gut health and how to restore it and how to actually take care of your body and not have to get on antibiotics every time they jump and say that you do. Because 90% of the time, you don't need it. 10% of the time, you do. I've dealt with mono. I've dealt with Lyme's disease. I've been able to jump those hurdles and you know, still come out and try to be on that vibration level. So it's I know people have struggles. I get it. It hasn't just been a perfect health situation my whole life. So, but I've been able to figure out things along the way, which I think is, I was told by someone like you very early on that was my journey. So
yes.
Yeah.
Yes. Well, we can be thankful for all the crazy stuff that happened to us when we were younger. I say thank you. Yeah, you know, when I was researching for my first book, I met somebody who told me a lot of people who have fibromyalgia have had surgery after surgery chasing what's wrong. And that's one of the things, that's why I have messed up feet. So they thought I had something and I didn't. So caused 30 years of chronic pain. So seriously, if you guys out there have anything going on with you that you cannot figure out, I would say please to give Dr. Cori a try, because as you see, she's got a lot in her bag of tricks. Okay, we've got one last question before we go. So Trisha says, my vision seems to be darker, got blurry after I had cancer and a hysterectomy. All my muscles and joints hurt daily now. So before Cori looks at that, I would ask Trisha, has that been in the last year? That's just from me. Okay, so what would you say about that? Vision seems to get darker. I'm assuming you probably went to a optometrist about that, I would say, but do you have anything to say about that after? So vision getting darker after cancer and hysterectomy.
Did she have, well, my question is, did she have chemo radiation treatment?
Cancer and a hysterectomy, that's all I have.
Okay. Well, it would kind of, I would have to probably have a few other, because it's from chemo radiation, then it could be from that, and there could be a lot of repair that needs to be done there. But it could also be a huge deficiency, because fighting all of that, going through all of that is going to really deplete your system. So certain minerals, certain vitamins that are on board that are needed to repair, especially for the eyes. You know, the eyes are huge, vitamin A, minerals. Mm-hmm. And so if it's just that, I would probably say it was, you know, some kind of a deficiency. But if she's gone through chemo and radiation, it's probably some damage done with that needs to be hugely repaired.
Definitely too, is that if you do have an eye problem, I'm assuming she says yes, I'm not sure was that yes to the chemo or radiation? Oh yeah, okay, she got new glasses, no chemo. Okay, one thing I would say, because it's really great to go to your eye doctor more often than you think, because eyeballs can go south pretty easily. What I would say is got new glasses. So Trisha, what I would say is, remember, in this energy, our vision is changing. So you may need more eye drops. You may need more rest in between watching your devices. I mean, there's a lot of, I wouldn't want to go down that road without really testing you out, or better yet, go to Dr. Cori. But we don't want to forget the eyeballs. Please, everybody, go to the eye doctor.
Start on some Bilberry support supplement. That would be a good place to start.
Yeah.
With some vitamin A. Mm-hmm.
And there's also something really remarkable called eye caps. And it's got all kinds of cool stuff. My dad had macular degeneration, and he was always eating those eye caps. And he kept it, he had that for years and years, and he was still seeing when he passed away from something completely different. So, Dr. Cori, do you have anything to say to wrap this up? Did you have a final statement so that we can thank you so much for coming in? Actually, also, final statement, and then can you tell us how to find you?
Yes. Well, number one, thank you for having me on here. I've really enjoyed talking to you and everyone, and trying to send out that message to really, again, if you don't have to live with all this chronic pain, you will probably have to make some changes and pursue some answers, but there is support out there. I see it over and over and over, more times than not. And I have great practitioners here. I've got, you know, Dr. Kina, who adjusts me. I've got Maria, who tests me nutritionally, and there's a great tester out in Redmond, Dr. Jeanette Birnbach. So there's people that may be right next to you that if you could just pursue. My clinic is called Pearl Chiropractic in North Tacoma, pearlchiro.com. If you have any questions, there's an email on there that you can shoot an email, and we can, you know, let you know. We take most insurances, so try to make it pretty. We do address the energy side of everything, but we try to make this as our business as professional as we can. So most everyone will feel comfortable. You know, everyone's on their different journeys, and sometimes if you know, energy can scare people, you know, different types of energy work. So we try to make it as comfortable and professional as possible, so everyone feels welcome, but we do try to address all of those aspects.
Mm-hmm.
Yeah.
Yeah, she does all the traditional stuff too, everybody. So I want to say to Trisha, ICAPS, just ICAPS, C-A-P-S. If you can't find them, let me know. The other thing she's talking about is Bilberry. It is Bilberry. It's a supplement. You can get that at Super Supplements. And I thank everybody so very much for coming on. What this has made me want to do is a week on chronic pain, if anybody's interested in that. My light bathroom reading at the moment is a book on chronic pain. Because our local Barnes and Noble, not Barnes and Noble, it was our local half price books opened up the other day. And so I went in there and I got all this cool light reading, which is all this weird stuff. And it was great. And I got one on chronic pain. So we might do that, everybody. But we want to thank Dr. Cori so very much for coming on. Thank you so much.
Thank you.
And I do love going in there. It makes me feel good. And she's helped me so much. So I just, I really hope you guys can give her a chance if you need her. So everybody, we will see you next week for Galactic Week. Make sure that you check out some of those people who are going to be on, because they are very up there in their field. So I'll be thinking over the next 3 days of the interesting questions I'm going to ask them, and I'll need your help. So thanks everybody. Namaste. Have a good day. We love you.